Healthcare reform efforts will soon impact every corner of America. And in order to keep pace with the demand for high quality and affordable care, the healthcare industry will continue to depend on their internal medical management departments to stay ahead of the competition. Care National Healthcare is uniquely positioned to support the nurse and physician recruitment efforts of medical management departments for health insurance organizations and medical providers throughout the country. Care National specializes in case management, utilization management, and quality management to provide a focused solution and expanded opportunities for both the healthcare organization seeking talent and the medical professional seeking to expand their professional experience. Care National Healthcare is headquartered in Scottsdale, Arizona, with regional offices in Los Angeles and Baltimore.
My name is Aaron Leibovitz, and I'm actually the Vice President of Client Development here at Care National Healthcare. I've been with Care National essentially since our inception back in 2010. I had worked in healthcare recruitment and ultimately decided I wanted to specialize in a growing area of what we call medical management recruitment. What I enjoy most about working here at Care National is the impact that we make in the healthcare industry. And while we work with commercial health plans, let's say, we also work with a number of organizations that work with underserved populations. So I really enjoy working within improving our healthcare system. I think we provide a lot of value in providing unique and passive candidates for critical openings within case management, and quality. So we also have a research department which does a lot of behind the scenes digging. They'll really go after some of the candidates that weren't even thinking about looking for a new position. They'll call into organizations that are essentially competitors of our clients. And again, our clients represent a wide range of managed care organizations, from health plans to third-party administrators, and a lot of the up-and-coming organizations involved in healthcare reform, such as accountable care organizations. I think we're different because of the strategies that we employ and the lengths that we will go to find people that aren't actively out there looking for new positions. We do really understand this industry, so when we're talking to somebody about an inpatient case management position, we know that this is somebody who typically needs a acute care foundation, working for a hospital, has kind of earned their stripes on the floor, has then moved into medical management and has worked, maybe in an ER in case management. So I think when it comes to the various types of positions, we have a very in-tune knowledge as to what our clients are seeking, and then how to find those people that are going to be really unique and passive candidates for them. For those that are in the capacity of human resources, it's a little uncomfortable for you to call into a competing hospital or a competing health plan for your own positions. Whereas we have a research team, again, that does the digging to find out who is in these capacities, and then we'll go ahead and call them just sitting at their desk and see if there's anything that might motivate them to look at a better career opportunity. I really enjoy working with nurses who really take a proactive approach in improving healthcare outcomes for patients. These are people that have a vested interest in reducing hospital readmission rates, for example. They're really reviewing charts to determine medical necessity. And overall, I think when it comes down to it, it's just about improving healthcare outcomes for patients and members of the plans that we serve. Personally, I get a lot of satisfaction in this job because I know sometimes years down the road, I'll get a call from a candidate who says, "You helped me get into this position. I just wanted to let you know that it was life-changing for me." Sometimes we hear that on the front end, and sometimes we hear that years later, which is obviously even better. But that's really one of the greatest satisfactions that I get, because when it comes down to it, it really ends up being a win-win-win. Of course we charge for our services, which is what we rely on for our livelihood. But it's really satisfying to know that we've improved somebody's career, and for our employer, we've given them a candidate that is going to improve their business.
Rewarding careers, responsive talent. That's Care National.